My name is Eric Robertson, and I'm not feeling so well tonight, so please bear with me, but I want to live up to my obligation, and I think what I'm going to talk about is very important for the city. I used to work for the Center City Commission, but now, as of yesterday, officially, I started a new job working for the Greater Memphis neighborhoods, which is an idea that's not my idea, but I was hired to implement the initiative. So I want to discuss it, and it's going to be a very minimalist presentation. The title of it is a simple idea to a complex problem, so I thought I would keep the presentation very simple. Simple idea to a complex problem. Greater Memphis neighborhoods, GMN, because that is just too long, and my email is eric@greatermemphisneighborhoods.com. That's so long, but there's nothing I can do about that. Monday was my first day at work, and I had an early morning meeting with Melinda Edwards. She is a friend of mine, and she made this quote, and I had to write it down. I thought it was great. Neighborhoods are the fabric of our society, and that's why it's so important that we get this right. So one of the things I've been working on since I was hired probably about a month ago was trying to boil down this very thick plan so people can understand it. And essentially it's a comprehensive strategic approach to creating Greater Memphis neighborhoods. And I like that they thought about the end result in the name. So they said, at the end of the day, what we want to do, we want to create Greater Memphis neighborhoods. And we're going to do that by concentrating on human capital, economic and community development. And then we're going to engage the following people: the citizens at large, neighborhood residents, the business community, government, so on and so forth. We want to get everybody, all the players around one plan working together, because right now we have a very scattershot approach to addressing the ills in our neighborhood. Research shows that the most important factor in determining a child, whether they would make more money than their parents is, if they live in a high poverty neighborhood. It used to be the class of your parent would determine that factor, but now that's changed. And also now they can tell, the health and economic education outcomes of children can be predicted by a simple zip code. Basically what they're saying, Department of Housing and Urban Development, is that we have concentrations of poverty, and it's leading to other issues. The idea: coordinate the major institutions and organizations around one mission and one plan, and focus on three areas: economic development, community development, and human capital development. As far as I can tell in the research that I've done, this plan is the first one to focus on all three of those areas. Here's the simple idea. We have a finite amount of resources. We can only do so much. Concentrate the efforts in 1 to 3 neighborhoods. Layer it with resources, very similar to what they're doing in New York with the Harlem Children's Zone. The idea: create a community development intermediary to drive the work. I feel so lucky in the sense that I left a very secure position at the Center City Commission. One of the reasons why I did that was I felt at the age of 36, how often will somebody pay you to create an organization? So, and this is the intermediary we'll be creating. People in target, this is going fast. Select the neighborhoods for a comprehensive target. So what we'll do, they've created an assessment tool. Right now, it's very subjective in how we decide which neighborhoods will get resources, which neighborhood will be transformed. There's an assessment tool that will be used, and it'll be a very objective. Develop a data-driven action plans. We will take the data that has been called together by University of Memphis as well as through the census, and focus on those issues in those neighborhoods based on the data. Allocate resources and implementation plans through partnering organizations. Strengthen the capacity of CDCs or community development organizations. Essentially, in Memphis, we have about 40 CDCs. We probably only need about 10 to 15. And we have organizations that were literally neighborhood watch one day and turn themselves into a community development corporation the next. Strengthen the capacity of community development corporations. So part of what we want to do is bring a professional service and expose people to a wide array of opportunities. Develop economic development agencies such as Main Street programs. Right now we're trying to do community development. Basically we don't have all the tools to do it. We have just one tool: CDCs and whatever money we get from HUD. Designate a lead agency that will be the focus point of leading that change, because once we come up with these great action plans, somebody has to implement them, and there has to be resources to do it. The work and the data-driven approach of the community development in the area will follow with the plan. So just meaning that we will follow the plan. It's a great plan, and it's very simple. The community development in the area will channel funds, and so this is what essentially we'll do. We'll channel funds from foundations, federal government, and other entities out into the communities, those targeted communities, realizing we have finite resources, and say we're going to take these three, and these are the neighborhoods we're going to concentrate on. This is our opportunity to get it right. To be a city of choice, we must have neighborhoods of choice. So, thank you for your time. Eric at GreaterMemphisNeighborhoods.com.